What can cause implants to fail? We all know that if we don't brush our teeth, we could get cavities. If we don't floss our teeth, we could get gum disease. But one of the things that I think is underrated for what can cause damage to our teeth are forces on the teeth, whether that's from clenching, grinding, and moving things the right way. One of the things I've noticed is that with implants, thankfully we don't get a lot of failures. On our bottom jaw, we'll see roughly 2% of implants fail, and on the top jaw, we'll see roughly 5% of implants fail, and this is over 10 years or so. But one of the things that can cause an implant to fail earlier is if there are misaligned forces or forces on the wrong part of an implant. Implants do really well with compression forces, but they don't do really well with side-to-side forces. This is a case of a patient we have. We noticed that the implant was loose, and we got the patient back in to take a look at things. One of the first things we did is we took a look at the bite forces that were on it. We do this by having the patient bite down on almost like a blue wax piece of paper there. Some of the things that we can see is that we've got a force or a mark over here. Now, it is really important that we get marks over here on our teeth because that's what we'll be chewing with. But over here is a force that is a force in the wrong direction. And so we can see that this crown that was put on the implant over here is actually in the wrong direction. We can see that the marks are appropriate over here on the teeth, but we shouldn't be getting interferences over there. And one of the things that will happen then is that we might see that implant get loose. So here on the back tooth, no mobility. On that one, that implant crown and implant are loose, and the tooth in front of it is doing fine as well. One thing we want to see as a restorative option, or the crowns on these implants, is that they are placed in the right position and we make sure that we are not getting those interferences on them.